Gurmagat Giancorla. Tánaiste, I want to raise with you the issue of the National Development Plan and in particular health infrastructure and the delivery of that under the National Development Plan. For many of the members in this House who support the government each week, we want to know that our colleagues in Cabinet are making the National Development Plan a priority and that those projects within it are a priority, but more importantly, we want to know that the mechanisms are being put in place to ensure the timely delivery of critical infrastructure. And I certainly welcome the Minister for Health's recent publication on the sectoral plan, which allocated almost €10 billion to the area, the most amount ever recorded to the area of health. And I do appreciate that in the next year that will amount to €1.5 billion alone in 2026. But the way that we will judge the performance of the people we support in here will be on the delivery of projects, and the way we will be judged will be by the delivery of specific projects in each of our constituencies. So, Minister, I want to raise some of those projects with you because that is how the government will be judged. Long-standing projects in Beaumont Hospital, at the Finglas Primary Care Centre, Saol in Ballymun, which I know you've been out and have visited, and also the redevelopment of the National Orthopaedic Hospital at Cappagh. Now, the €30 million allocated for Beaumont Hospital was very welcome, and I know there are colleagues here in the House. I see Deputy O'Murray, Deputy Heenan, my own colleague Deputy Brabazon, who are working with the hospital to ensure that the 20-bed cystic fibrosis unit is delivered later this year, the 95-bed inpatient unit, and also the new ED. But Tánaiste, we want to see clear timelines on some of those projects. Being in the capital plan alone, we have learned, is not enough. I also want to raise the issue of the primary care centre in Finglas has been bogged down in a lot of planning over time, but we are now getting to the point where enabling works, the moving of pitches to facilitate new sports facilities as part of the primary care centre and so on, is all starting. Again, we want to make sure that the HSE prioritise that project. On Saol, which, as I said, you have been out and have visited a centre for those with acquired brain injuries. We had a very welcome visit from Bernard Gloucester, and we have a commitment that that project is now at design and tender stage, and we hope that that will be concluded by the summer of this year, and that we'll move then to have a new facility where a new national CDNT team will also be, neuro team will be also be in place. But again, clear timelines on that are needed too, Tánaiste. And Cappagh, anybody who has visited Cappagh, and I visited with your predecessor, Deputy Varadkar, the old Nightingale wards stand there. They wait to be replaced. There's a master plan that I think cries out for investment, and I would like to see more in the capital plan as it is published, which I believe may happen in the next number of weeks. We want to see clear timelines.
Thank you, Deputy.
Delivery, and that's in every constituency across the country, Tánaiste.
Well, I want to thank Deputy McAuliffe for raising this issue, and first I want to say we agree with him, and all of us on these benches agree, because thankfully we're now in a position, where we can actually provide a very significant level of funding when it comes to capital. So roughly speaking, we're planning on spending €275 billion out to 2035 on capital, and that's badly needed. It's badly needed for housing, it's badly needed for the enabling infrastructure for housing and a growing population, and it's badly needed in terms of the delivery of modern public services, including in our health area too. So can I just say I agree with you, and I know my colleague Minister Chambers also agrees with you, that the challenge now is going to be, alongside funding, making sure we cut through the red tape and the bureaucracy and the bottlenecks and the gates and the stages and this, that and the other and the external consultants, that has led us to a situation where big projects are taking far too long to deliver. And that's not consequence free. It has a real impact in your constituency and mine and right across the country. I am pleased to say that in addition to the work that Minister Chambers did around the Accelerating Infrastructure Task Force, we're now seeing real delivery. So he had a proposal at Cabinet this week that we estimate will cut around 20 weeks off the delivery of projects by not having to go back to external consultants. So I just say that by way of both form, and I hope some kind of credibility in terms of your constituency and action in relation to that. On health specifically, we're expecting the HSE capital plan to be published, as you rightly say, in the next couple of weeks, the next short number of weeks, and the Minister for Health will keep in close contact with you in relation to that, and with all our deputies across government too. You've referenced a number of projects in relation to Beaumont, the cystic fibrosis facility, which I know is important. You referenced Deputy O'Murray and Deputy Heenan too, a very important facility that we all feel strongly on, the extra bed capacity, the ED. You also referenced Finglas Primary Care Centre. My understanding is that The tenders for phase 1 have been received by the HSE, and they expect a positive outcome on tender award over the coming weeks, and enabling works are now anticipated to commence on the site in the middle of this year. Which I know will come as a welcome relief after a long period of time for your community and waiting for that. I'm really pleased you mentioned the Saol project. I've given a commitment to coming out, and I'd be delighted to do it with you to see that project again. I feel very passionately about this. I've gotten to know them personally. My colleague and friend, Councillor Gail Ralph, raised this with me as recently as Saturday, but I'd be very, very pleased to go out with you and visit Saol and make sure we get this over the line. This is a chance to transform lives. A huge amount of work has gone into this by Saol, but also by the HSE, and I know Bernard Gloucester has been very committed to it, as have you, Deputy McAuliffe, and I'm committed to working with you to try and get that over the line very shortly too.
Thank you, Deputy McAuliffe.
Thank you, Tánaiste. I think you've identified something there. For a long time, I believed when we had no money in the country, we had multi-stage processes to show that a project progressed, but it wasn't actually getting anywhere. Now we're in a situation where we have plenty of money and the multi-stage processes are delaying projects. And not often there's importance to have public scrutiny and public money as well. But we do need to see that delivery. And as I say, I don't doubt the commitment of the Minister for Health on this, but at every level in the HSE, people need to know that these projects are desperately needed because of the increase in our population, desperately needed because of new emerging needs, but desperately needed also because a facility like Beaumont Hospital is now over 40 years old. It was a state-of-the-art hospital at the time. It now needs critical investment. And equally in Finglas, we have a desperate shortage of GPs. And GPs are an incredibly important mechanism to be able to access health. Because of the demographics in the area, it's not as attractive as other areas where people might pay for private visits. It's entirely reliant often on medical cards. Therefore, all the more reason why the HSE would provide facilities such as a primary care centre.
Yeah, I don't disagree with anything you've said, and it is now about delivery, and the Minister for Health is very committed to it, as is Minister Chambers, as is the government. Our challenge in this government, and we all identified this in advance of the last election, is going to be putting the resources that our country has now to work in terms of getting these projects moving. I do think there are encouraging signs. I have seen a level of focus an appetite for this reform in the new infrastructure division of the Department of Public Expenditure Reform. And you're right, we have to translate this now to every level of the public service. And I don't say that critically, but you can have a policy here and we need to make sure that that's translated right down to the front line as well. And we'll be very eager to monitor that very closely with the Minister for Health, with the HSE, and at the Cabinet Committee that we now have on infrastructure delivery too. But I do think this is a year where we'll see good progress for Finglas in terms of the primary care centre. Beaumont Hospital, we're all very committed to that. We see a number of projects, and I want to await the capital plan in fairness to the HSE. I'm always conscious that these projects being delivered in a live hospital site does present extra complexity, which I know they're factoring in too. And let's keep in touch on this in the coming weeks.
Thank you, Tánaiste.